What's up, guys? Doc Brown here, doing a little hot or hella hot video on heat exhaustion and heat stroke, especially because it's getting to the time of year where it's hot or hella hot. We're getting ready to go to annual training, so I want you all to keep this in mind. We're going to start off over here with my little mannequin, and then we'll move into a little bit more protocol type stuff. So this side is going to represent our heat exhaustion. The red side is going to be heat stroke. We'll go from the head down. So when you are suffering from heat exhaustion, you start feeling a little faint, a little dizzy. You're going to sweat a ton. Your skin is going to be cool, pale, and clammy. You can potentially have some nausea and vomiting. That also crosses over to our heat stroke side. Your pulse is going to be rapid and weak. So when you feel it, you're not going to feel it very strongly. That's all that means. And you're going to have some muscle cramps. Going over to our heat stroke side, you're going to have a throbbing headache. You're going to stop sweating. And those two signs in my book are really the key points you need to remember. If you stop sweating and you have a pounding headache, you need to get to some cooler areas real quick. Your body temperature is going to be 103 or above. Some of the newer literature is saying 104 or above. But if you're reaching 103, you need to be cooling down real quick. With heat stroke, your body or your skin is going to be hot to the touch. It's going to be red, and it's going to be dry. It's going to be dry because you stopped sweating, because you have nothing left to sweat out. Your pulse, when you feel it, is going to be strong and rapid. And LOC is loss of consciousness. You have the strong potential to lose consciousness in this particular instance. Again, not good at all. With heat exhaustion, you're going to get them to a cool place with air conditioning. Drink water. Just sip on it if they've got some nausea or if they've been vomiting. Do a heat dump. The best thing you can do is jump in a cool shower and then do some ice sheets. If you're onto the heat stroke side, call 911 and follow the same things that we did over here with our heat exhaustion. Do a heat dump and move to a cooler place. And over to our protocols. Kind of just like what we just said, our heat exhaustion is going to be, in this particular case, under 104. You've got your headache, you're dizzy, nausea, vomiting, tachycardia. For those of you that are non-medical, that means your heart rate is fast. And your mental state is going to be normal. Moving down to your heat stroke, pretty much the same things, but it's going to be above 104, and AMS stands for altered mental status. Think of it as somebody is drunk but has not been drinking. We're going to do to manage it just like we just mentioned. You're going to get some early cooling, stay in the shade as much as you can, drink water. I know in California this year it might be a little hard. I don't know, some of you may have been to Hunter Liggett before. I haven't, but based on what we saw at Camp Roberts, I would say it's a fair chance that we're going to have not nearly enough shade. And considering their wildfire season has already started, we can expect some real warm temperatures, 100 or 100 plus. Then we're going to move into our cooler environment. So again, shade. If that's all you got, use the shade, preferably into an air-conditioned room or tent. Your ice bath is going to be your #1 choice for rapid cooling. Then it's going to go ice sheets, then dumping water on the person, and then a wet towel and a fan. If you're down to just a wet towel and a fan, take the person's shirt off, set the wet towel on their chest, and have the fan blowing across the chest. That's going to suck the heat out of their bodies. It's been shown more effective than if you just slap a wet towel on somebody. If they have some altered mental status, they could be low on blood sugar, so we're going to give them some oral glucose. We would be carrying, basically it's a tube of frosting. I think I have a lemon flavored one in my pack, but you're going to have something along those lines. If you don't have that, any kind of candy will do. If they're unresponsive, you're just going to put it right in along their gum line, between their teeth and their cheeks, and that should suffice. And then with both heat exhaustion and heat stroke, you're going to more than likely have dehydration. So we're going to enact our dehydration protocols. We'll get into that at a later time. If you have urine that looks like Pepsi or Coke, that's real bad. That means you haven't been drinking any water. It also means that you're going to be in rhabdomyolysis. If you remember a few years back, some of the football players down in McMinnville at the high school down there went into rhabdo. And they ended up having to go to the hospital. It's not a fun thing to do. For those of you that work out real hard, think of it kind of like a buildup of lactic acid, but doesn't go away. And instead of having lemonade colored urine or clear, it's going to be that dark Coke looking urine. When we do an IV on these patients, they're going to take 2 or 3 liters of crystalloids. Again, for you non-medical people, that's just your normal saline or your lactated ringers. We're going to treat for nausea, vomiting in both cases, and rhabdomyolysis we can get into later. But again, think of it as a buildup of lactic acid after you work real hard in the gym. Our evac protocols, if you're in heat stroke, so that's the worst of the two, it's going to be an urgent evac and routine evac for heat exhaustion. Again, heat stroke, 104 with altered mental status. We're going to take a core temperature, so silver bullet, that's how we're going to get that temperature, as well as all of this extra stuff: headache, dizzy, nausea, vomiting, tachycardia, and, well, not normal mental states in this one, but that's that. Give you one more quick look here. Happy 4th of July. Drink beer, freedom on. See you guys later.